Elderly citizens are the most vulnerable in our community, for which everything possible is being done in order to reduce the risk of infection transmission. But despite this, 3 residents at Hillside were found to have contracted Covid-19 on Sunday. Their relatives have been updated on their condition, which is currently described as stable, with medics remaining on the lookout for changes, given that days 5 and 6 are the most critical in the evolution of the illness. All 77 staff members at elderly residential services have been swabbed to identify if any one of them is carrying the virus, given that none are said to be showing symptoms. With visitors banned, Dr. Antonio Marin said it was therefore assumed that the infection must have come from a worker. As part of the measures in place, temperatures are being taken twice a day, with any increase detected immediately notified to the medical team and the resident placed in isolation. Most residents are aware that there has been a change in their circumstances, given that all staff members are wearing masks and routines have changed. Dr. Marin is clearly concerned over their well-being.
We all worried, but we cannot panic. So we'll do everything is in our hand to try to control it. We know that we're fighting with an enemy that we cannot see. But every measure that we put into place is try to minimize risk. So we all in danger, but we'll do everything we can to protect the most vulnerable of our society.
There's 24/7 medical care in all the residences, and in answer to GBC questions regarding the triage rules being put in effect for the use of emergency equipment, such as respirators, Dr. Marin said doctors would follow guidelines issued by the National Institute for Health and Care Excellence, NICE. Everyone will therefore be considered within the escalation plan.
Depending on the frailty, it's not about age, but it's about function. We will provide the best treatment that the person should be having. In our premises, we'll be able to provide non-invasive ventilation. I would like to inform there are a number of our residents that, in view of the functional level, they will be considered even for ventilation, so those will be transferred to hospital.
Public health experts have informed the government that the measures put in place have already saved lives. The Deputy Chief Minister says everything that could be done has been done. However, like elsewhere, the number of cases continue to rise. There are now 95 confirmed cases locally, 49 of whom are still active. 45 of these are at home, with 3 in Hillside and 1 in St. Bernard's. There are 270 pending results from swabs taken from people with symptoms. However, there are a further 158 results also pending from the random sample of 400 being carried out. 159 people have been swabbed so far, with the 1 result returned being negative.
We have done everything that can be done. It is impossible to do more. The latest data shows today 126 free beds at St. Bernard's Hospital. But this, as I said, could change in an instant. Indeed, the advice from public health is that it will. We are on a curve like other countries. Your government has acted quickly to protect Gibraltar. The aim is to contain the spread. We have done so on public health advice, the advice of real experts. We have taken steps when we needed to. We are prepared for the worst and hope for the best. The steps that we took have already saved lives. This is what our experts tell us. But we need your help also. We should confine the virus, not spread it. You should leave your home only if you have to. Do not find excuses to go out.
269 persons have volunteered to be considered as nursing assistants, with donations also continuing to roll in. The Deputy Chief Minister described Gibraltarians as a tough and resilient people, adding that it's heartening to see how we are all standing together against this killer virus.